Hello, my name is Jaime Acosta, Jamie, if you prefer. I am a community pharmacist in Spain and the FIP Community Pharmacy Section's Executive Committee Secretary. After watching this video, hopefully you will be able to understand the difference between cold and heat therapy in the management of body pain, understand the individual benefits of cold and heat treatments in the management of body pain, and identify best practice and safety precautions when advising patients on the use of cold and heat therapy. This video aims to enhance pharmacists' knowledge and skills and equip you with the knowledge and confidence to make informed recommendations on the use of cold and heat therapy, ultimately improving patient outcomes in the management of body pain. In this video, I'll provide a brief introduction to body pain. I'll explain the differences between cold and heat therapy and how do they work to relieve different types of pain. You'll learn when to use cold therapy instead of heat therapy and vice versa. And finally, I'll discuss best practices and safety precautions for pharmacists advising patients on using cold and heat therapy effectively. Although everyone has felt pain at some point, not all pain is identical. Some types of pain are temporary, while others are lifelong conditions. Acute pain is sudden or urgent pain and often caused by specific injuries or events, for example, a surgery, broken bones, cuts, etc. Chronic pain persists for over 6 months and varies from mild to severe daily. It is frequently caused by health conditions like diabetes, cancer, fibromyalgia, circulation problems, back pain, etc. Without appropriate treatment, chronic pain can affect a person's quality of life and can lead to depression or anxiety. Neuropathic pain is caused by nerve damage. It can feel like a stabbing, burning, shooting, or sharp pain. It can cause difficult sensations such as hot, cold, and touch. Neuropathic pain can be caused by cancer, alcoholism, stroke, limb amputation, chemotherapy, radiation, or diabetes. Nociceptive pain is the result of tissue damage. It can be described as a throbbing, sharp, or aching pain. This pain is caused by external injuries, such as falling, bumping into things, or being hit. Nociceptive pain can be felt in the skin, tendons, muscles, joints, and bones. Body pain is a prevalent condition leading to decreased quality of life and increased healthcare costs. It is a frequent reason for consultation in community pharmacies, where pharmacists are often the first point of contact for patients seeking relief from symptoms. Given the pivotal role that community pharmacists play in healthcare delivery, there is a need to enhance our capacity to manage body pain effectively. The 2023 Insight Board, conducted by the FIP, report in the link, provided valuable insights into the current practices and challenges faced by pharmacists in managing musculoskeletal pain. One of the key findings was the potential benefit of integrating non-pharmacological treatments, such as heat and cold therapy, with traditional pharmacological approaches. Although they work through opposed physiological processes, both cold and heat therapy play crucial roles in pain management. Understanding the distinct benefits of each and how and when to use them effectively can greatly enhance the treatment and relief of both acute and chronic pain issues. Cold therapy, also known as cryotherapy, causes vasoconstriction, which reduces blood flow painful area and is recommended for pain associated with swelling and inflammation. Cold therapy relieves inflammation by slowing down the inflammatory process, reducing swelling and discomfort. It also helps to relax spasming muscles, which can greatly improve range of motion and reduce pain. Cold therapy is very useful for acute injuries, right after sustaining an injury such as sprain, strain, or minor tear. Post-operative pain, cold therapy is useful after surgery to minimize pain and swelling at the surgical site and muscle soreness. For example, after an intense workout, cold therapy can ease muscle soreness and support quicker recovery. Common examples of cold therapy include topical gels or creams with compounds such as menthol, ice packs or rubs, cold or ice baths or showers, and cryotherapy. By reducing the temperature of the skin and muscle of the affected area, the subsequent reduction in blood flow and metabolic processes reduces inflammation and swelling, helping to reduce pain effectively. Heat therapy, also known as thermal therapy, induces vasodilation. This process increases blood flow to the affected area, supplying oxygen and nutrients necessary for tissue repair, and promoting also muscle relaxation. Heat therapy has been shown to alleviate muscle pain, reduce soreness, and loosen tight muscles, making it a valuable adjunct to drug therapy. By increasing the temperature of the skin around the muscle area, heat therapy also improves blood flow and elasticity of the connected tissue, helping the sore and tightened muscles relax. This eventually reduces the pain and muscle spasms by eliminating the buildup of lactic acid that is responsible for delayed onset muscle soreness. Heat therapy is mostly recommended for areas that are affected by stiffness and tension, mostly the neck, back, and shoulders. Common examples of heat therapy include powered heating pads, blankets or rubs, hot baths, showers, hot tubs and saunas, topical gels or creams with compounds such as capsaicin, and physical therapy-based heat such as ultrasound. When to choose cold therapy versus heat therapy for effective pain management? When deciding between cold and heat therapy, it is essential to consider specific criteria. Cold therapy and heat therapy provide distinct advantages and are not interchangeable. There are situations where heat therapy could exacerbate an injury, whereas cold therapy may offer therapeutic benefits. Heat therapy is not recommended for people with conditions such as dermatitis, multiple sclerosis, or diabetes. In some specific causes of pain, it may cause disease complications, progression, or exacerbation of inflammation. Therefore, caution is required in any condition with sensory impairment, such as I said, multiple sclerosis, spinal cord injuries, autoimmune diseases with joint pain, activated osteoarthritis, poor circulation, and cancer. It should be avoided immediately after acute injuries such as fractures, sprains, and strains. Instead, heat therapy is best used to treat conditions such as arthritis, muscle stiffness, and soreness. For instance, use cold therapy immediately after an injury like a sprain, and not for heat therapy for chronic conditions like osteoarthritis. Application techniques and safety precautions vary depending on the type of cold or heat therapy being used. It is important to educate patients on proper application techniques and to check for any contraindications before use. Counter-irritants, such as topical creams or patches containing ingredients such as menthol or capsaicin, provide localized pain relief by creating a mild irritation on the skin. They are easy to apply and act directly at the site of discomfort without entering the bloodstream, minimizing systemic effects compared to oral non-steroidal anti-inflammatory drugs. For heat therapy, ensure that heat packs are comfortably warm, not excessively hot. Sessions should be limited to 15-30 minutes per application, and always advise the use of a cloth or towel as a protective barrier to prevent burns or skin irritation from excessive heat. Some marketed products, patches, allow longer application to 8 hours or even 12 hours of heat. For cold therapy, also always advise the use of a cloth or similar barrier when applying cold packs to prevent frostbite. Apply cold packs for 15-20 minutes at a time, allowing the skin to return to normal temperature between applications. For patient education and counseling, as pharmacists, we are, of course, in a unique position to educate patients about the correct use of cold and heat therapy. Emphasize the importance of choosing cold and heat therapy according to the condition. Advise on proper application techniques and duration to maximize effectiveness, and ensure that patients understand safety precautions to avoid skin damage or burns. In conclusion, cold and heat therapy are valuable tools in managing body pain, offering patients safe and effective options beyond medications alone. As pharmacists, our role is crucial in guiding patients towards the right choice for the pain relief needs. In summary, cold therapy is ideal for acute injuries and initial inflammation, while heat therapy is better suited for chronic pain and muscle relaxation. As key points recap, cold therapy reduces inflammation by applying low temperatures to a recently injured area and is used for acute injuries, post-surgery, and muscle soreness. Heat therapy increases blood flow by applying heat to a painful area. This can be particularly beneficial for chronic pain conditions. By improving our understanding and counseling skills, we are empowering patients to make informed decisions about their pain management. Thank you for joining me today. I hope this video has provided you with valuable insights into integrating cold and heat therapy into your practice. Together, we can make a meaningful difference in the lives of our patients. Thank you very much.